In Afghanistan, the Taliban has made big gains this week. They're surrounding a number of cities. They've taken control of a provincial capital. They assassinated government officials. Has all of that caused any reflection, second thoughts on the part of the White House when it comes to the Afghanistan policy or any changes in the strategy there?
Well, first, let me strongly condemn, on behalf of the government, of course, the assassination of Dawa Khan Menapal, the director of the Afghan Governmental Information Media Center. His murder follows the bombing attack in Kabul earlier this week that targeted the acting Afghan defense minister. The Taliban has claimed responsibility for this later attack, and there's no reason to doubt reports they are responsible. Additionally, there are credible reports, as you've touched on, of atrocities and retaliation against civilians in other Taliban-controlled areas, which, of course, we are closely tracking and concerned about. If the Taliban, our view is that if the Taliban claim to want international legitimacy, these actions are not going to get them the legitimacy they seek. They do not have to stay on this trajectory. They could choose to devote the same energy to the peace process as they are to their military campaign. We strongly urge them to do so. This is what the Afghan people so urgently need, deserve, after decades of war, and is very much in Afghanistan's neighbors' interest to invest renewed energy into a peace process that promotes a peaceful Afghanistan and stable region. As it relates to the decision, we knew from the beginning, and the president would be the first to say this, that there are difficult choices a commander-in-chief needs to make on behalf of the American people. He made clear, the president made clear, after 20 years at war, it's time for American troops to come home. And as he said at the time, the status quo was not an option. The Taliban was prepared to attack U.S. and NATO troops after May 1st, which was the deadline for our departure. He also feels and has stated that the Afghan government and the Afghan National Defense Forces have the training, equipment, and numbers to prevail. And now is the moment for the leadership and the will in the face of the Taliban's aggression and violence. As you know, last week the president announced new requirements for federal employees and contractors and asked the private and public sectors, universities and healthcare systems, state and local governments, and other institutions to take steps, and many of them are answering his call to action. So this week, one of the largest nursing home chains announced they'd require vaccinations for employees. Massachusetts will require vaccination for nursing home staff, and Maryland and Virginia announced vaccination requirements for state employees. I'd note 2 of those 3 states are led by Republican governors. Just today, United Airlines announced it will require all of its roughly 85,000 employees to be vaccinated by the end of September. So our message is simple. We support these vaccination requirements to protect workers, communities, and our country, and we hope to see even more action from the public and private sector over the coming weeks.
Why is the administration sort of acting so slowly here? You're highlighting all the different efforts, businesses and some states are taking on this vaccination front. Shouldn't the White House sort of lead in front here to sort of try to really increase the sort of maybe wield that stick a little bit more for people who are still waiting on the sidelines and not rolling up their sleeves?
Well, Zeke, I would say that the president led 8 days ago by delivering a speech where he conveyed that the federal government would be taking actions, conveyed that there would be requirements for federal government employees and contractors, and also asked the public and private sector to take actions on their own. And we're seeing that happening. So we are going to consider a range of options. There are factors, as I think you all know, as you consider these policy options, pros and cons. We're making all decisions through the prism of what is in the interest of public health, but we're going to let that policy process see itself through, and certainly we want to make decisions as expeditiously as possible.
Could you describe a little bit about what the overarching ask is within the federal government to look at things like what levers do you have to further spur vaccination? On the nursing home piece, is it using Medicare dollars and linking that to nursing homes? Is it regulatory action? What sorts of things can you help us to understand where that policy might go?
Well, I certainly understand your question. I'm not going to be able to lay out too many details of internal conversations. I will note that certainly we have applauded the steps taken by a number of states as it relates to requirements of nursing home employees and health providers to get vaccinated. We've seen states do that. We've seen some health providers do that. That's a positive step. And as noted in some of the reporting, that's an area of early discussion. But again, early pre-decisional discussion. We're going to make decisions from the federal government that we believe will save lives and we believe will protect the most vulnerable populations. that will incentivize more people getting vaccinated and bring an end to the virus. There are pros and cons to many of these policies. That's part of the discussion as well. We haven't seen to date a direct impact on the economy from Delta, but we anticipate supply chain impacts and certainly know those would be factors. I will say that, as the President talked about earlier today, one of the way that we designed the American Rescue Plan and our economic recovery plans was to plan for the potential for ups and downs because we knew an economic recovery would include them.